All right, so look at the anterior forearm muscles here. One thing that makes this region so cool is just how many muscles are jam-packed in here. We can start out first. We have this muscle right here, which is going to be that brachioradialis. All right. If we move toward the pinky side, we can make out 4 superficial muscles. This first one right here being the pronator teres. It's kind of oblique looking. And then we move over here. This guy, which I can get my probe under right here, is going to be the flexor carpi radialis. Then moving over here, we have the palmaris longus. And fun fact, this is a variable muscle, meaning some people have it, some people don't. And the way you can kind of test that out is by taking your thumb to your ring finger and then flexing a little bit, and you should see a tendon bulge out or not. But we can see as we course up, it's going to connect onto this palmar aponeurosis, which is that piece of connective tissue here. But as we move out one more time, we have this last muscle, which is kind of hiding on the side. I can kind of clamp it right here. That is going to be the flexor carpi ulnaris. Okay, so the way I like to remember all these, is because they're kind of a mouthful, is starting with that brachioradialis. That's our landmark muscle again, because it's originating from that lateral aspect of the humerus, whereas those other 4 coming from the medial side, you can all see. So the first one being the pronator teres, right? I like to think PF. So pronator teres right here. That next one is going to be an F. We have flexor carpi radialis. Okay. Moving on from there, we have another P, the palmaris longus, and then lastly we have that flexor carpi ulnaris. Okay, so those are our superficial muscles. If we want to see the next deep layer, I can move these 2 aside, and you can see this muscle deep to it, this thick one right here, and that's going to be flexor digitorum superficialis. Flexor digitorum superficialis. If I move that guy to the side, we have these 2 other muscles, one on the ulnar side, one on the radial side. This bigger one on the ulnar side is going to be flexor digitorum profundus. This other one right here is going to be flexor pollicis longus. Okay, and then no, we're not done yet. We can move these out, and this last one, kind of a square looking muscle, we have the pronator quadratus.